So I'm Rudi, I'm the Clinical Director for EvoDental. Our clinical solutions at EvoDental are sort of geared around treating the vast majority of people that need this sort of work done. Ordinary people who are having very serious dental issues on a daily basis, and it's got to the point where it's affecting their quality of life, and we don't believe that this should be an ultra niche or an ultra luxury product that only the wealthiest people can afford. Our aim is to bring this sort of treatment to as many people as is feasible, although we do appreciate that it's still an investment in oneself to have something like this done. Starting with our EvoSolution solution, which ticks all the boxes for somebody who wants something fixed, supported by dental implants, teeth that they don't have to take out of their mouth at night time, that on a daily basis anyone you interact with or you talk to or you eat in front of wouldn't know that it's artificial. It's supported by 4 implants, which has been long established as a very predictable way of replacing all of the teeth. So 4 implants and a set of teeth connected to those 4 implants. Evo Advanced takes things to another level with the addition of 2 further implants in each jaw, as long as anatomy allows, of course. And what that gives us is, first of all, more contingency, because we now have more support and we are able to provide teeth that extend even further back in the jaw, so ideally suited for people who are used to having their very back chewing molar teeth, as well as those people with a big wide smile who show everything all the way to the back. It's sort of our mainstay in our product range, and it's a great solution for people who are looking to have fixed teeth. And then finally, the ultimate is our ability to put sort of some artistic skills into the mix by upgrading the upper prosthesis with a zirconia based prosthesis. It still has a metal framework to give it the reinforcement that it needs, but zirconia, being a much harder material, is sort of harder wearing, but also the fact that it's a ceramic means that we can stain it and glaze it and make it look even more beautiful from an aesthetic standpoint before it goes into a furnace at a very high temperature before it's all finished and ready to fit. So that gives us a little bit more ability to play with the aesthetics and take things to another level, and it's ideally suited for our patients who are a little bit more discerning from the aesthetic standpoint. All 3 solutions are there to cater for people who have either no teeth or they're facing the loss of all of their teeth in at least one of their jaws, and it means that they don't have to suffer dentures at any point in the entire workflow, because all of our solutions will provide fixed teeth supported by those implants on the same day as surgery.